in, and we're excited to announce the new 4-pack special. Go to mypillow.com, click on the 4-pack special tab, and save 50% off the 4-pack, which includes 2 MyPillow premiums and 2 Go Anywhere pillows. Use promo code SKY at checkout or call 1-800-635-1825. That's 1-800-635-1825. Or go to mypillow.com, click the 4-pack special tab, and use promo code SKY at checkout.
I'm Michelle Franzen, ABC News.
The views and opinions expressed by the host and callers of this program are not necessarily the views of Genesis Communications, its management, or its sponsors.
Genesis Communications presents the show that's helping people see better and feel better all over Florida. It's Ask the Doctor with board-certified optometric physician, certified nutritional specialist, and popular radio host, Dr. Michael Lange of Lange Eye Care and Associates.
Doctor, my eyes, I cannot see the sky. Is this the price for having learned how not to cry?
Okay, good morning, and welcome to Ask the Doctor. I'm your host, as usual, Dr. Michael Lange of the Lange Eye Institute, Fortify Vitamins and Paleo Simplified. If you've got a question regarding your vision, eye care, or a nutritionally related topic, now's the time to pick up the phones and give me a call. We are live in the studios today. It is August 25th, 2018, and the phone number is 727-586-2820. That's 727-586-2820. I don't know if we're coming in through the Facebook right now. I think we're having some technical difficulty, but we're going to be working on that, and hopefully we will get that up and going soon. But you can certainly give me a call. All right. If you're new to the program, who's Dr. Lange? Well, I'm a board-certified optometric physician. I'm also a certified nutritional specialist. I'm the founder of Lange Eye Care and Associates. We opened 13 locations in the state of Florida, and founder of the Lange Eye Institute in the Villages. It wasn't but a couple of years ago, I sold all of my practices except the Lange Eye Institute. So if you want to see me, you got to come to the Lange Eye Institute in the Villages, which is very close to wherever you are. It's the dead center of the state of Florida. It is the fastest growing geriatric population in the entire country. Actually, the fastest growing population in the entire country. It's Golf Cart Central. So the Lange Eye Institute is on the corner of County Road 101 and 466, right next door to Publix, and across the street from Publix, next door to CVS. I do want to announce that October 20th, put that on your calendar. You know, we always have a fall festival every year at the Lange Eye Institute. Sometimes it's country western. One time it was 50s. One time it was 60s. So this is going to be a racing theme. All right. So bring your race cars out. Bring your cool cars out. We can make it like a little car show in the parking lot as well. I'm going to bring my race Vipers. A couple other buddies of mine are going to bring their race cars. And it is on October 20th, Fall Festival at the Lange Eye Institute in the Villages. Put that on your calendar. We usually have thousands of people that show up. We'll have food, we'll have drinks, we'll have music, a lot of fun. We're going to have a frame show. Frame vendors will be there, a trunk show. We're going to have amazing deals on the latest in designer frames. Fortify Vitamins, of course, will blow out with all sorts of deals. Paleo Simplify will have all sorts of deals as well. So remember, October 20th, put that on your calendar. I do want to do a shout out to Mackenzie Lange, my daughter, who's going to be playing in Sarasota today with her school volleyball team. That's Skycrest. They're playing in a big tournament in Sarasota. I can't make it. I was going to run a tape today, but I got to be there for my dad's inauguration into the swimming pool today. We're going to lower him in the pool over there at Brookdale Bayview. So he's going to be doing some rehab in the pool today. His wound on his hand is healed up enough now so it can get in the water. So that should make him happy. I got to be there for that. I can always see my daughter play volleyball. All right. We're going to go to the phones. I wonder who's on one. Let's see. Bob, good morning. Welcome to the program.
Good morning, Dr. Lange. Good to speak with you this morning. I'm glad to hear your dad's doing better. Is he keep me from falling? Are we still counting down that?
Hallelujah. It's been almost 4 weeks. He hadn't fallen. You know, when I was in Europe, he fell 3-4 times, and every time he fell, he broke a bone or lacerated part of his body. And that's when I got him the heck out of Dodge and put him over here. I got to say, Brookdale Bayview is a independent and assisted living facility. It's a nice place. And I think if somebody's looking for a place to go to have some assisted living or independent living, 3 meals a day. I mean, my parents are 90 years old now. They're still, my mom's in amazing condition still. But Dad, after the 4 falls, moving pretty slow. And this is helping him. He wants to get back to his lake house. He keeps saying, wants to go back to Picayune, Mississippi. And I said, well, when you can get up and down on your own and go to the bathroom on your own and things of this nature, then we'll talk.
There you go. That's what you got to do, Doc. Thank you so much for that.
Mm-hmm.
I'm calling this morning, Dr. Lange. I have developed a problem in my ears. It's probably a low-grade tinnitus. It's kind of like the old days when television was in its infancy, when the TV was turned on before the networks came on. There was that snow, we used to call it, and there was that low pitch buzz.
Right.
Well, that's constantly with me now. Not to a point where it keeps me awake at night or anything else, but when it gets quiet, it's there. Generally, my normal activities during the day kind of override it, so it's not a nuisance. Do you have any suggestions?
Yeah, tinnitus can be a big problem, and it's more problematic as you get older, as you well know. And I would definitely see a hearing specialist. I mean, is it ringing, buzzing? Is it roaring? Is it hissing? What kind of symptoms are you actually having?
No, like I said, it sounds like the TV sets of snow way back when, and it's low volume because, like right now, as I'm talking with you and my window's open in the truck, the traffic overrides it. But when things get quiet, then it's there constantly. It's not a disturbing thing, but nonetheless, it's there.
Mm-hmm. Yeah, that's an interesting condition that many of my patients have. You got these tiny little delicate hairs in the inner ear, and they kind of move around in relation to sound waves. All right. And this triggers these cells to release basically an electrical signal. So think about that static on your TV, and these electrical signals go through the nerve. I think it's the auditory nerve. This isn't my area of expertise, to your brain, and your brain starts to interpret these signals kind of as a sound, and you get this really weird electrical impulse causing the tinnitus. And I got to tell you, most of the time it's fairly common. It's usually after the age of 60, it's much more common. You know, I would check to make sure there's no earwax in the canal. There's a whole host of other things that can cause tinnitus. I mean, something that's also with the eye is a Meniere's disease. If you had any trauma, head injury, neck injury, you fell, you hit your head. I mean, even temporal mandibular joint problems, TMJ, can aggravate it. We got to worry about other things causing tinnitus. I mean, tumors, believe it or not, usually benign tumors, things like acoustic neuromas, and people that use the Bluetooth more frequently. And hopefully you're not wearing a Bluetooth on your ear, are you?
I am, but it's not working. I'm talking into the phone.
Well, I would stop wearing the Bluetooth. It's as simple as that. I would do the old-fashioned way where you pick the phone up and talk. Basically, speakerphone is the best way, all right? Blood vessel disorders, things like atherosclerosis can cause it. High blood pressure can cause tinnitus. So there's a whole host of things that can cause it, and I think the best thing is really to talk with your physician about it. I mean, if it's not any better, you may want to see an ENT. You could always start for a free hearing evaluation with Michael Moore. I mean, it's free upstairs at the Lange Eye Institute. You know, you can look in there and see if there's any wax buildup or anything like that and find out actually what you're capable of hearing. And it's no money out of your pocket. So that's a good way to start. And then he can certainly make a referral after that.
Okay. Well, I've been a carpenter for almost 50 years. So saws and drills and impact hammers and the like. So.
Right. So it's probably pretty common. Let me ask you this. Have you been on any, and I think the answer is probably no, but have you been on any large amounts of antibiotics lately?
Well, I'm having some dental work done, so they pre-treat me, before I have my dental work done, but that's not excessive, I don't think.
Right. So there's certainly medications like antibiotics can aggravate tinnitus. Aspirin, if you're taking high dosages of aspirin. And there's a lot of other medications that can aggravate the fact as well. But I think, number one, age, now you're over 60. Number two, the exposure to all the loud noises, working in the construction industry, all of that. So it's probably nothing to be concerned about, but it's always better to err on the side of caution and look into it a little bit deeper.
Okay, I'll do that. I'll call Dr. Moore and set something up.
Yep. And as far as supplements go, I don't know of any supplements that really help tinnitus. I've seen some where they promote it, but I haven't seen studies that really prove that. The best thing is to eat, try to eat organically raised foods as much as possible. A paleo type of diet, Google the Lange diet plan. The Lange diet is a modified paleo diet that has some fermented foods in it. So the same things we always preach, for anti-aging, eating a good diet, exercising, getting plenty of sleep, mild to moderate amounts of sunshine. All of these things will be beneficial as well.
Okay, doctor. Very good. You going to be out bouncing off the wall next week?
No, my first race, I just got signed up. I got to finish signing up, actually, is in New Orleans. We'll be heading down there. I'll be there 6th, 7th, 8th, and 9th. So Thursday, Friday, Saturday, Sunday. We set up camp Thursday night. Practice is Friday. It's open track day. And then Saturday, I'm in a NASA race, and Sunday, a NASA race. And it's interesting. Some of my boys from my old stomping grounds, Al Copeland Jr., his dad started Popeye's Fried Chicken. I used to race motocross with those guys, are going to be racing against me, and in Vipers as well. Al Copeland has a Viper that's slightly modified, I should say. So he'll be in my class. So I look forward to going back to New Orleans and enjoying some good competition from those coon asses.
Is that next week?
No, that's the 6th, 7th, 8th, and 9th of September.
Okay. Right.
And then the 15th, I hit Miami Homestead, and then the 30th is Sebring. So those are 3 days I'll be running tapes.
Okay. But next week you'll be live.
I'll be live again next week. Good Lord willing.
Okay, brother. Thank you
Bob.
so much for your time, Dr. Lange.
Take care.
Bye-bye now.
All right, you're listening to Ask the Doctor. I'm your host, Dr. Michael Lange. Give me a call, 727-586-2820. 727-586-2820. I'm going to take the next caller in just a second. If you're watching me, I'm holding up a box of Paleo Simplified Nutty Fruit Bliss Bars. These things you can get all over the place, but you can buy them right on Fortify.com or PaleoSimplified.com. We're doing a 50% off on all the bars. But let me just tell you about this Nutty Fruit Bliss really quick. What's in it? Dates, unsulfured apricots, tart cherries, cashews, raisins, pumpkin seeds, goji berries, unsweetened coconut, hemp protein, and spirulina. The ORAC value of these is off the chart. It has a higher ORAC value than any bar on the market. It is not a Snickers bar. It is not a Mounds bar. It has a unique taste because it is all raw. A lot of Ironman competitors are eating them. Professional athletes are eating them. Even kids eat them. You have to acquire the taste. I love them, but the main thing is good for you. Low glycemic index. You can have one for breakfast, and you don't need to eat until 1 o'clock. Gives you prolonged energy. That's why they're called Paleo Simplified Energy Bars, because they give you energy, low glycemic index, so they're diabetic friendly as well. Very low amounts of sugar that is instantly released. So use the code BAR50. BAR50 at the Fortify website or Paleo Simplified website, and you get 50% off on them. We also have chocolate, coconut almond, and pecan pie. All right, we're going back to the phones. We're going to see Mike in Riverview. Mike, thanks for holding. Good morning.
Good morning. How are you?
I'm hanging in there.
Good, good. I'll just get right to it. My right eye has been closing for 6 months to a year. I can't seem to keep it open. I've been to the doctor 5 or 6 times. The first time he said blepharitis right away, gave me the wipes and different things, drops. Did not help, seemed to make it worse. Then did all the testing. Been back again. I've even had Botox put in my right eye. It seemed, of course, to make it very lazy. It seemed to help at first. However, I felt uncomfortable that it changed my eye, the way it drooped. And then I'm going back to the doctor. Getting ready to have an orbital exam, MRI, and it is very debilitating because it's very hard to drive. It just wants to close on its own. And I literally have to hold my eye open with my hand most of the day. It's a 95% of the day thing.
Yeah, it sounds to me like you actually have something called a blepharospasm, not blepharitis. Did anybody mention blepharospasm to you?
They have. They have mentioned that the last time I went. It's the same institute, but like 7 doctors in there. And he mentioned that, and that's when he wanted to do an orbital exam. And, I even got a neurologist appointment.
Yeah, I absolutely think that's important. A neurologist is going to need to see you. You're going to need to have an orbital MRI, an MRI of the complete brain, actually, all right, just to err on the side of caution. A lot of things can cause one eyelid to sag, okay? The levator muscle can be damaged. It could be related to trauma. It could have been trauma a long time ago, okay? It can be related to what we said called a blepharospasm. It can be related to, I hate to say it, but a lesion in the brain, all right? There's other types of entities that cause one eye to sag and then the other eye to sag. Now, let me ask you this. Your pupils, when you look at your pupils in the mirror, do they look even?
They do. From what they've said, my vision, everything is fine. I did have a heart attack last year. I don't know if one has to do with the other, but it was quadruple bypass on Mother's Day of 2017.
Oh, wow.
So I don't know. I know that stroke goes up 80% or something like that after that. And I don't know. I did ask the last doctor if that could be the case, that I might have had a stroke or mini stroke or something and not know it. And he said it's possible, but I've had no definitive, yes, you had a stroke, because he didn't rule it out, but he didn't want to say, he said it's possible.
Right. So you haven't had any, weakness on one side, any tingling in your extremities, any, loss of speech, face sagging on one side or anything like that, right?
No, I have just that. Well, I've noticed the tremor with the eye when it shuts. I've noticed my cheek kind of does the same thing now around my lip on that same side. It's like a little twitch. I've noticed, but it's again very debilitating, very depressing because it's there, and I'm on the way to work now. I listen to you every week, and I'm like, I need to ask a couple questions.
Yeah, it sounds to me like you have something called benign essential blepharospasm. Now, I obviously can't diagnose that over the radio, but there's a foundation, and it's actually called the Benign Essential Blepharospasm Research Foundation. But Google that when you get home and just read up on it, all right? And it'll enlighten you and talk to you about how this can be very, very mild and nothing to be concerned about. But we always want to err on the side of caution. Like I said, you sound relatively young. How old are you now?
I will be 60 in about a week or so.
Yeah, you're 59. You're still a baby.
59. Yeah, 59. It's so difficult that, day to day.
Did the Botox help? Did the Botox help open it a little bit?
It seemed it made it. He put a lot in, so right. He told me it was more of a trial and error. So the one doctor said that it's a good idea to go ahead and do it again, because sometimes that it could it's a trial and error thing. So I do have it scheduled just because it's so irritating, and I'm hoping that will help. It did help keep it from closing completely, but it looked like lazy, like I was halfway winking all the time.
Right.
And I, just want to make sure. They wanted to do eyelid surgery, but I didn't think that one. And one more question: would it have to do with a nerve or a muscle?
It could be both. It actually absolutely could be both, and it could be either or. And it's up to the doctor to determine that. Let me ask you this: are you very tired lately?
Yes.
All right, because then there's also something called myasthenia gravis, all right? And they can do a blood test to determine to rule that out. Even thyroid problems can cause this. It sounds like you're in good hands and they're trying to, uncover any stone and figure out what it is. And I would say the surgery is the last option. They want to try to find the underlying etiology first and make sure it isn't something like myasthenia gravis, because then if you do surgery and it goes away, then the lid's going to be too far up, okay? Just the opposite. So, I wouldn't overreact. I would, follow your doctor's instructions, get all the tests done. I think you definitely need some sort of imaging of the orbit and the brain to rule out something potentially serious. And that should be done fairly soon. All right. And then let us know let us know the results.
I will. And it is set. The MRI is set. The orbit, I guess he called it an orbital MRI.
Good. So when that comes back and it's normal, you can go whew and sit back and relax.
Okay. All right. I really appreciate it. I like I said, I listen to you often, tried to get in and called first thing, and I really appreciate you talking with me.
My pleasure. You take care of yourself. Good luck. All right. Yes, blepharospasms are, fairly common. It's exact symptoms that he's discussing, and it's more common as we mature, and he's still a young one. I'm going to tell you, I'm right behind him. I'm 56. I'll be 57 September 15th. So 57 is the new 37, let me tell you. All right, phone lines are open. 727-586-2820, 727-586-2820. Let me give you the phone number for the Lange Eye Institute. If you'd like to set up an appointment to see me or any of our great doctors, Dr. Lori Caputi, Dr. Yadi Exposito, and now Dr. Michael Tolentino, world-renowned retina specialist, is in the Lange Eye Institute on certain days. The phone number for the Lange Eye Institute is 352-753-4014. Write that down. Get a pen, paper. 352-753-4014. Also, the Fortify Vitamin location, we're open Monday through Friday. We're located in Ocala is our headquarters. We may be expanding that thanks to you guys. We've been really busy. Fortify phone number is 866-503-9746. One more time. That's 866-503-9746. Fortify Vitamins. Anything I talk about, you can usually call them. We're going to talk a little bit more about dry eyes. We're going to talk a little bit more about early detection of Alzheimer's. I got a lot of emails from you guys from the last show. We talked about how we can detect it in the eye. But let's go back to the phones. Steve, good morning in Tampa.
Good morning, doctor. Before I get to my question on grapeseed extract and arteries, you mentioned falling a lot, and callers mentioned falling and your father and so forth. This is just another one of the fascinating things the body does that we take for granted. I mean, it would take an equation a mile long to try to explain to us, to begin to explain how God keeps this body, which is completely, and in many cases, extremely out of balance, upright. And we take it all for granted. So we've got to listen to you, and we've got to eat right. But my question is about grapeseed extract and arteries. I'm hearing a lot about that being great for clearing your arteries.
So that's interesting you bring that up, because that's a relatively new study. Hey, let me get a little sip of spring water. Hold on. So adding grapeseed extract to your diet now, some new studies, or I should say some emerging studies, are discussing it may help prevent atherosclerosis or hardening of your arteries, okay? And this study, if I recall, was in guinea pigs, however, okay? So atherosclerosis or hardening the arteries, you know, is one of the leading causes of death. I mean, you have stroke, you have heart attack, your carotid arteries get hard, your aorta, the tiny little arteries that feed the optic nerve and feed the retina. So that's one of the biggest risk factors for macular degeneration, something called ischemic optic neuropathy, not to mention a heart attack and a stroke. And, you know, we talk about things on this radio show all the time, taking your omega-3 fish oil, eating your fish, cardiovascular exercise, losing the weight. Most of us can pinch a lot more than an inch. So getting down to your ideal body weight, but adding some grapeseed extract and even pycnogenol, this pine seed bark extract. There's some minimal studies that talk about that as well. I like the grapeseed extract a little bit better. But remember, most of these studies have been on animal, and they were using, I think it was, I'm not 100% sure, but I think it was a guinea pig study, the most recent one, and it looked very promising. So if it works in animals, it probably works in humans, but we've known that grapeseed extract has some benefits at improving circulation for a long time, so maybe that's because it's lowering atherosclerotic plaque. It's also a very potent antioxidant. The ORAC value, that's the oxygen radical absorbency capacity, is actually very high on grapeseed extract, and I've been using grapeseed extract in our fortified tablets for, geez, you know, ever since I invented it. That was one of the first antioxidants that I put was grapeseed extract, and then bilberry. So those are two of the first that I used. So yes, I think it's a good supplement for us to take.
And the word of the day, doctor, is I heard it again at the gym from a friend of mine the other day who's 30 or 40 pounds overweight. I keep hearing this from people. I just got my blood test. Everything's great. People, you are not, and you will go with me on this, you are not in good health if you're 30 or 40 pounds overweight. You are not in good health if you smoke cigarettes. I don't care what your blood test, you hear it all the time.
Oh, yeah. All the time.
Sick if you are doing these things. There's something wrong with you. You've got to get it fixed. So thank you, doctor, and good luck on the racetrack.
All right. Take care, Steve. Bye-bye. And a lot of that is related to the sugar epidemic. Everybody loves sugar. I mean, I tell you. And the, you know, regular natural sugar that comes from fruits probably is not bad as long as you don't overdo it. All right. And that's why I always say breakfast and supper should be protein and vegetables. Breakfast and supper should be protein and vegetables. Breakfast and supper should be protein and vegetables. I didn't say fruit. I didn't say have 2 grapefruits, a glass of orange juice, and a bowl of Fruit Loops. I didn't even mention oatmeal, did I? No. Your breakfast should be like a free egg range omelet with stuff with some kale and some spinach and onions and mushrooms and maybe some goat cheese or manchego cheese. Remember, you want to use goat cheese and manchego cheese because goat cheese comes from goats. Manchego comes from sheep. These have A2 beta casein protein. Stay away from any cheese that comes from a cow unless you know it comes from an A2 cow. So therefore, you can have A2 cow's milk for breakfast. There's nothing wrong with milk and there's nothing wrong with eggs, but make sure it's either goat's milk or A2 cow's milk. A lot of you have these digestive issues and we're told to stay away from milk because you're lactose intolerant. But indeed, you may not be lactose intolerant. You may be having a reaction to the beta-casein protein that's in that milk. So try the A2 cow's milk, try the goat's milk, and goat's milk doesn't taste bad. And stay away from the sugar, especially in the morning and especially in the evening. Remember, your blood sugar goes up the highest, especially you diabetics that are having a big bowl of pasta or rice or potatoes. That's sugar, okay? You're not having, you know, a praline and you're not having a chocolate cake maybe, but pasta, rice, and potatoes and bread is sugar. So those type of carbohydrates are not the best thing in the world for you. Remember, everything in moderation. Every now and then, yes, you can have a pizza and spaghetti and meatballs. And the best time to eat that pizza and spaghetti and meatballs, believe it or not, is at lunchtime, not supper. Lunchtime's the best time. Remember, breakfast and supper should be what? Protein and vegetables. Google Lange Diet, Lange Diet Plan. I've developed a diet that I've thought about for years and years. I initially developed it for my overweight patients that had diabetes and macular degeneration. I wanted something for these patients because they were losing vision rapidly. They were all overweight. The Lange Diet, I have some patients that have lost enormous amounts of weight. One of my patients was almost 500 pounds and lost half their body weight on no medication now, including no diabetic medication. Remember, God made a pretty good body if we give it the right fuel. The right fuel. All right, let's open up the phone lines. You got a question, you're listening to Ask the Doctor. I'm the host, Dr. Michael Lange, 727-586-2820. That's 787-586-2820. We're broadcasting from Largo, Florida. This is 8:20 a.m. We're also on a variety of FM stations at the same time throughout the state of Florida. And we are live up on the internet now, on News Talk Florida Facebook. We're live now, so I got a big smile. Also sporting a new hat, if you can see it. What are we going to talk about now? Let's see. October 20th is going to be the big fall festival. Put that on your calendar. October 20th from 11 to 3 at the Lange Eye Institute. I've been doing this for 20 years. So this is probably like the 20th annual fall festival. We usually have a big crowd. So come on out. I'm going to bring the race cars. I'm going to have some other friends of mine bring their cars. You don't have to have a race car. You can have a hot rod or just a cool car. Bring it on out. That's going to be the theme, a race theme. All right. I want to mention, I talked a little bit about Alzheimer's, old timers, dementia. Everybody seems to get it after the age of 90 these days. It's kind of true, right? So why are we getting it? That's a good question. There are some genetic link-ups. We do know that we can detect it early in the ball game now through an eye exam. And the key with most things is early detection. Some of the studies are indicating 10 to maybe even 20 years detecting it early. If we detect it early, then we can make some lifestyle and dietary changes, or who knows, put you on a medication one day if it's been proven to be beneficial to maybe reverse or decrease the chance of you getting Alzheimer's, all right? Alzheimer's, that's hard to say, or any types of neurodegenerative diseases. So when you go to your eye doctor, whether it's your optometrist or ophthalmologist, most are not going to know this. 98% are not going to know how to detect Alzheimer's through the eye. So we have some special equipment at the Lange Eye Institute in the Villages. I don't want to brag, but we are the only eye institute in Gainesville, Ocala, the Villages, Leesburg, Orlando, or Tampa that actually has this piece of equipment. It's called a tinnitus RHA. And what this does, it actually looks at multi-levels of the retina. Starts at the very front, goes to the very back. It does a pseudofluorescein angiogram. It also does something called autofluorescence. And the reason this piece of technology is so cool, it helps us not only detect macular degeneration early, before the doctor can, before even technology like OCT technology picks it up. We can see these early RPE changes at a cellular level in the retina with this device. It can pick up melanoma. That's right. Melanoma can hide in the eye. Then by the time it's metastasized and the doctor found it on your arm, it's too late. You're dead, okay? So the key is early detection. It can pick up holes and tears in your retina. It can pick up diabetic retinopathy. But it's also looking for some telltale signs of Alzheimer's. We're looking at lipofuscin, a metabolic waste product in your retina. We're looking at nerve fiber layer thinning that is associated with Alzheimer's. We're looking for drusenoid bodies that are associated with Alzheimer's. We're also, when we do a slit lamp exam, every doctor uses this is an eye doctor. We look for a type of cataract called a cortical cataract that is also associated with Alzheimer's. So those three things looking in the eye, nerve fiber layer thinning, drusenoid bodies, and cortical cataracts can be associated with Alzheimer's. If we see all that, then, even if we don't see it, I'm discussing proper nutrition with my patients. Maybe taking a tablespoon or two of organic coconut oil every day, cooking in coconut oil, using turmeric as a spice frequently in your foods, eating a lot of fish. So the perfect meal for macular degeneration and the perfect meal for Alzheimer's would be wild Alaskan salmon sauteed in coconut oil, using turmeric spice all over it. Use some organic spinach, organic kale, orange bell peppers, and put a free-range organic egg over the top of it. That's amazing. It has phospholipids, lutein, zeaxanthin, astaxanthin, omega-3, and a great source of protein, beneficial for both the brain and your retina, not to mention your muscles. All right, we're getting ready to take the next phone call. I think it's another Steve in Clearwater. Steve, good morning.
Yeah, I've been studying that subject, as you know, and I think one of the most interesting things, it seems to be stronger than any nutritional thing that I've looked at over all the data on Alzheimer's, is that they're finding that people who work in jobs, it's called the novel versus repetitive ratio. In other words, as a doctor, you're constantly thinking new, novel thoughts with each patient, and you're done.
Right.
Some people have jobs where they literally can learn the job in 30 minutes, and they do that job for 30 years. And the ratio of what you do for a living versus novel compared to repetitive thinking or actions seems to have, like, for instance, certain professions that are highly intellectually based, like lawyers, doctors, get very little Alzheimer's. And it's because their brain seems to be constantly challenged, as opposed to, doing the same thing again and again and again. And it's extremely strong. It's more strong than practically anything organic they've found. And I'm thinking that, maybe people who, a lot of people are in jobs where they're not really having to do things, maybe participating in some kind of going to a school or taking a class at a college or something like that would be good for us, even if we don't really need that as an academic credential.
Right.
Something to think about.
Absolutely. I think, and my dad used to do that, after he retired as a physician, he would still go to continuing education, still take all sorts of classes. And I mean, he's still sharp as a tack at knocking on 90. Now, he falls a lot, but his brain's cognitively still superior to most.
Well, that's the cerebellum that's knocking him down, not the cerebrum. So
yeah.
He's got a good, but sometimes falling and stuff, there's so many things that can. Did they know what actually caused the falling?
He initially fell a year and a half ago, and I got to tell you, due to pure stupidity, if Dad's listening, he was trying to take his motor off the back of his boat, his bass boat, at 87 and a half years of age, picking up a 130 horsepower Evinrude and trying to pull it off the back of the motor, off the boat to work on it. And he fell backwards and that motor fell on him. Luckily he didn't die, but he crushed his vertebrae, broke his back. And so ever since then, Steve, a broken back does that to you when you're 88,
You know what they did for the astronauts? The astronauts used to bounce around on the moon, and you see how they look like they were drunk?
Right.
Because they didn't have enough weight. They didn't have a sense of balance. In other words, the pressure points on the foot were, plus they were wearing those real thick, soft shoes to prevent them from the heat. So that they weren't getting feedback from the foot as to whether they were slightly right or slightly left. And what they did, I think they put some sandpaper or something in the space boots so they feel the change a little bit more. And I'm wondering if that would work for elderly people. If you put something in the foot where they get more feedback as to whether they're leaning right or left or forward, you think it'll work?
I have no idea. His legs are so swollen right now. We got to do something to decrease the swelling. Remember, he used to bike 10 miles a day. He had plenty of circulation going on. So that's why I'm going to try to get him in the pool today, get a little gravity off of his body, and let him maneuver and swim around in the pool. I think he'll be able to do that, and then that can help improve circulation. And who knows, maybe that helps with his whatever this type of neuropathy, peripheral leg edema. He has no heart problem, so it's not congestive heart failure. I think it's just lack of being active, because he's been active all his life.
Maybe we can build a big centrifuge for him.
If anybody can, Steve, you can.
Okay, God bless, and I'll get back to you on what we were talking about on the email.
All right. Thank you, Steve.
Okay.
Bye-bye. All right. Phone lines are open, 727-586-2820. That is 727-586-2820. We are on Facebook. I'm waving to you guys now. Hopefully enjoying the show. Once again, I'm holding up a Paleo Simplified bar. This is Nutty Fruit Bliss. I love them. They're delicious. Some of you won't think they're delicious, but remember, it's a raw bar. It's an energy bar. If you're into your health, if you're especially on a paleo diet, this is the best bar on the market. It has the highest ORAC value, the highest antioxidant capacity. Remember, I put like 32 goji berries in every bar. Since I'm an eye doctor, goji berries are super high in zeaxanthin, improve reaction time, visual performance, improve focusing ability, improve night vision, and also help to combat against oxidation, which is rusting in the body and the eye. So goji berries are very good for you. But it also has tart cherries. It has spirulina. It has cashews. It has dates in it. And then remember, we have the coconut chocolate almond, and we have the pecan pie as well. Learn more about them at paleosimplified.com. You can order them on both websites or go to fortify.com. Remember, 50% off for the rest of the month. The month is almost up, all right? Today's August 25th. 50% off all Paleo Simplified bars for the rest of the month by using bar 50. Now, I do want to talk slightly about a special we ran last week that was huge, and we're still running it probably until the end of the month only. So August 25th, the end of the month is right around the corner. The Fortify Organic Blue-Green Superfood. This is 10 servings of organically grown fruits and vegetables, high therapeutic amounts, 1,000 milligrams of most of the nutrients in it, spirulina, wheatgrass juice, barley grass juice, kale, spinach, all the good things for your retina and your brain, blueberries, strawberries, cranberries, cinnamon, peppermint leaf, and parsley and cucumbers, all in this. No added fiber, because fiber blocks the absorption of many of the antioxidants. 25 calories, 1 gram of sugar, so it is very good for you. You put it in milk, and it's a complete meal. You put it in milk with a scoop of the Fortify Super Protein, and it's a super meal. So 50% off this superfood. Most superfoods come from China. Every ingredient in this comes from America. 50% off if you use Superfood 50. A lot of you took advantage of it. It's a great deal. We're running it to the end of the month, and we got to stop it. It's as simple as that. We can't run it till after the end of the month anymore. So Superfood 50 at the Fortify website, fortify.com. That's FORTIFEYE, fortify.com. All right, we're going back to the phones. I think it's Mary in Dunedin or Dunellen? Dunedin. Good morning, Mary.
Hi. I'm I talked to you before, I'm the RN certified diabetes educator. Not many RNs go into that field, I'm finding out. Anyway, I have a question, but I'm wondering, when are you coming back to this area?
All right. So when I sold my business, I have a 5-year covenant not to compete for 5 miles. Okay. So if I could get a circle around my last 3 locations and 5 miles around, if I found a good location, you know, I very well may open an office there. I just, between what I'm doing, I haven't had time to look.
Really, I know we're all very busy, but, you know, I don't drive to the villages. So I'm thinking, you deserted us. I'm very unhappy, but that issue isn't I have a son who is 50, right? And he lives up north. And before we hang up, maybe you can tell, how do we get your Saturday show up north?
Well, you can't pick us up on the internet, but you can also just go to Facebook, and you can watch me live on Facebook. Go to News Talk Florida Facebook, or you can go to any of my Facebook sites. I got 10 different Facebook sites for Fortify Vitamins, Paleo Simplified, Dr. Michael Lange. I mean, so any of my Facebook sites, or go to News Talk Florida Facebook, and then you can watch me live on the days that I'm live. And then you can always go, if you want to watch any of the older shows, I have an archive of them, the videos, and also some race videos. If you want to get your adrenaline up, you can go to Ocular Health channel on YouTube. So YouTube Ocular Health channel, you can join up, just subscribe to it, and then automatically all the new videos will come. So this video today that we're doing right now will be posted in 2 days on Ocular Health channel on YouTube.
Okay, I think, because I'm not on Facebook. Anyway, thank you for that information. Okay, he's 50 years old, 51, and lives in Illinois, where I'm from. Anyway, he's saying he has dry eye. So if you could talk about dry eye, I can hang up the phone and listen to what you're saying on the radio.
I'll do it.
Okay, and of course he's a guy that says, well, it'll go away. I'll buy something, but because he doesn't want to admit that maybe he's got a little issue there.
Right.
So anyway, thank you. I'll wait to hear that you're coming to the area. And what else? Okay, I'm going to say goodbye.
All right. I'll talk about dry eye. Bye-bye. All right. Diabetic educators are extremely important because I see so many patients. They get on their diabetic medication, but they're not taught how to eat correctly, and a lot of their problems is related to the food they're intaking, the wrong food. So dry eye is something that we all are going to have sooner or later, all right? We're all going to have dry eye symptoms. Eyes that feel sandy, gritty, burn, tear, itch. The older we get, the drier we get. Certain medications increase the dryness. Just driving the car with air conditioning on makes your eyes dry. Driving the car with the window down, the roof down, all that dries your eyes out. And the majority of medications that we're taking, diuretics, antidepressants, antihypertensive medications, anti-allergy medications, dry us out even further, okay? The lack of blinking, all right? You're concentrating on the computer, driving your car, so blink reflex is diminished. All of these things, lack of proper vitamin and nutrition causes dry eye. So you wonder why everybody has dry eye. So there's a simple 6-step approach that I talk to all my patients about that helps, I would say, 90% of my dry eye patients. It's pretty simple. We heat the lids. We clean the lids, all right? We lubricate the eyes. We nutrify the glands. And we hydrate the body. Actually, this is 5-step, not 6-step. The 6-step is a procedure. So we heat them up. We heat them up with a warm washcloth, or better yet, you get the Brooder mask. All of this you can get at Fortify.com. We have an extreme dry eye kit that's about 40% discounted over regular. An extreme dry eye kit at Fortify.com, where it has everything you need, from your vitamins to your lid scrubs and your Brooder mask. So we heat the lids up. Hot compress 2 to 3 times a day for 5 to 10 minutes. While you're heating the lids up, you massage the lid margins. That breaks down the lipid barrier, helps you secrete a healthier tear film, all right? Number 2, we lubricate the eyes. The problem with most artificial tears you buy over the counter, or like most vitamins you buy over the counter, ain't too good, all right? So the one I like the best is Oasis Tears Plus, by far the best. It has hyaluronic acid in it. It's a natural anti-inflammatory. It lasts about 30% longer than most of the other stuff my patients buy over the counter. My second favorite would be Blink Tears, but the preservative-free version, which is very difficult to find over the counter. You can get those on the Fortify.com website. So lubricate the eye, heat the eyelids up. Then nutrification is crucial, all right? Omega-3 fish oil. Everybody needs omega-3. I got to tell you, even if you're allergic to fish, there's a triple distillation process that removes all antigens and all proteins. So in theory, you shouldn't have an allergic reaction. However, if you're allergic to fish, don't take the fish oil unless you're in front of the emergency room, okay? So omega-3 fish oil gets into the meibomian glands, helps open them up, especially when you do the hot compresses. The combination of those two is very effective. Add one of our pills that's global now called Fortify Focus. The lutein and zeaxanthin, great for your skin, great for your retina. Lutein and zeaxanthin does not really help dry eyes, but it helps your retina. It helps decrease the chance of macular degeneration, helps guard against the harmful side effects from the computer, the blue light. But it's the astaxanthin that is in the Fortify Focus. Astaxanthin is a potent anti-inflammatory and a potent antioxidant. It helps lower inflammation in the glands, helping to secrete a healthier tear film. When I add Fortify Focus to the Super Omega, it's amazing how much better patients' eyes feel, but the stress is relieved, and their whole body, their joints even feel better. The third prong of a nutritional approach is adding gamma-linolic acid, GLA. You got to get it from black currant seed oil, not borage oil, not evening primrose oil. And there's reasons for that. I don't have time to talk about it. Black currant seed oil. And you want at least 70 to 80 milligrams twice a day. That's about 160 milligrams of GLA. And you can go heavier, more than that if you want. But the triple whammy for dry eye from a nutritional standpoint is 2 Fortify Super Omega, 1 Fortify Focus, and 1 GLA pill that has about 160 milligrams of GLA from blackcurrant seed oil. I have been developing a product called Fortify Dry Eye Therapy or Fortify Dry Eye Extreme. I haven't named it yet. I'm hoping to have it out in the next month or two that has all of that in one box, okay? But you can buy it currently at fortify.com and look at the Dry Eye Extreme. We have Super Dry Eye Kit, Dry Eye Extreme Kit. So remember, we heat the lids up, we nutrify the glands, and we use lubricating eye drops, and then we clean the lids. We all have a bacterial flora hanging out on our eyelashes. Some people have bacteria, viruses, antigens. Some people have mites called Demodex. So if you're not sure and your eyes are really crusty, sometimes matted shut in the morning, buy something. We can buy it online. You can get it at fortify.com called Clearadex. Comes in a foam. It comes in a pad, either one. It burns a little bit like Bengay because that's killing the little bugs, all right? Clearadex kills the mites that are on your eyelids, and it gets rid of the bacteria, the viral and allergic flora. You scrub them right before you go to bed. Or you can use baby shampoo when you're in the shower. Nowhere near as good as the Clearadex, but it's better than nothing. Clean your eyelashes. We brush our teeth, but nobody cleans their eyelashes, right? We wash under arms, we wash our hair, but nobody cleans their eyelids. So there's that four approach, lubrication, heat, clean, and nutrification. And the final thing was, well, we're all dehydrated. We're all dehydrated, all right? I'm drinking water. I'm forcing myself to drink water. I have some eternal spring water that I just dropped on the floor. So you got to drink more water. Most of you drink 2 cups of coffee in the morning and a glass of wine or a couple of beers in the evening. You got to drink 3 cups of water to offset the diuresis effects of the coffee and the booze. So if you had 4, that's times 12. That means you had to drink 12 cups of water just to get back to equilibrium. No wonder you have heart palpitations and dizzy spells and you feel bad because you're dehydrated. So drink more water. Add a couple of glasses of coconut water as long as you're not a diabetic. Coconut water is very high in potassium. A potassium deficiency can also cause dry eye. So eat a banana a day, all right? Drink some coconut water. So now you have the 5-step approach for dry eye. Do this for 3 months. 90% of you are going to do great. You don't have to have these expensive procedures like IPL, or LipiFlow, or meibomian gland probing. If you do these steps, your dry eye will respond. You'll save a bundle of money. Now, if you still have dry eye, talk to your optometrist or ophthalmologist about putting little plugs in your drains. It's like putting a stopper in the bathtub. It's called punctal occlusion. It keeps your tears on your eye, bathing your eye in your natural tears. We do it in 2 phases. We put collagen plugs in first. It takes literally 5 seconds to do. It's painless. You don't even need an anesthetic. It's covered by insurance. Those last about 3 to 4 days. If during that 3 to 4 day period before they dissolve, your eyes feel much better, and then they dissolve and all your symptoms come back, that's a sign to put the permanent ones in. They're made of a soft medical silicone. They go in very easily, no anesthetic necessary, and insurance covers it. We can take them out as easy as we put them in. So if you have dry eye, punctal occlusion does work. They're very expensive drugs you can use. Xiidra is a good one. Restasis is a good one. But I don't think you need those if you do what we just talked about. And then for those of you that have extremely dry eyes and you want something that's covered by your insurance, there's stem cells that we can use via an amniotic membrane, something called Procara. We use this at the Lange Eye Institute in the Villages all the time, and it works. So you can have the driest of dry. Remember, I'm in the Villages practicing. I have patients that come in that literally have dust coming out their eyes, and they leave and they're very happy. And the majority of these things that we do is covered by their insurance and covered by Medicare. All right, I'm going to give you some phone numbers. We're getting close to the end of the show. We still got 3 minutes. I mean, maybe we could take one call. Yes, we can. I'm going to go quickly. Karen in Keystone Heights, good morning.
Good morning. How are you, Dr. Lange?
Fabulous. How are you doing?
I'm doing fabulous also.
What can I do for you?
I have a question for you. What is your opinion on MCT oil?
Medium chain triglycerides. Is that what you're talking about?
Yes, sir. Uh-huh.
Well, I mean, this is a type of fat that's found in certain oils, all right? It's very high in coconut oil, all right? And there is some emerging science that suggests that this type of coconut oil, is it the medium chain triglyceride, or is it the lauric acid, or is it something else that's in coconut oil, palm kernel oil, things like this, can help dementia, Alzheimer's especially. So, like I said, MCT is medium chain triglycerides, and I think it's good stuff. However, I would take the coconut oil unless you just hate the coconut oil, because it might be something else in the coconut oil that's doing it, not the medium chain triglycerides.
Okay. No, I use coconut oil all the time, but I've just been reading a lot about this MCT and didn't know which was better.
Right. No, coconut oil. Stay with that. They're trying to get rid of, some people don't like the taste of coconut oil, trying to put it in a pill. So we're out of time. I got to go. Thanks for tuning in, listening to Ask the Doctor. I'm out of here. I'll be back next week for another hour live. Have a great day. God bless you.
Not to cry.
The new home of the Bubba the Love Sponge Show. We welcome all the Bubba Army to WWBA Largo, Tampa Bay.
And W252DF, 98.3 FM, Largo.
Pope Francis arrived in Ireland this morning for a 2-day visit. The Pope is there to lead an outdoor mass tomorrow in Dublin. His visit, though, coincides with renewed outrage over the Catholic Church's sexual abuse scandals. The Pope speaking out today. ABC's David Wright is there.
In his remarks, he said the failure of the church adequately to address these repugnant crimes, his words, has rightly given rise to outrage and remains a source of pain and shame for the Catholic community. This papal visit